Welcome to another community conversation with the Petoskey Regional Chamber of Commerce. I am Nikki Devitt, and I am very excited to be joined today by Dr. Karen DenBesten, the infectious disease physician who is the director at infection prevention at McLaren Northern Michigan. We are going to do a little back to business. Thank you so much, Doctor, for joining us today.
Thanks for having me, Nikki. I'm just really glad to be here to share some thoughts and ideas about how to get back to business and be safe here in Petoskey. I think everybody's been isolated for a long time and they're anxious to get out and get back to business, but we need to talk about how to do that safely to prevent further spread of coronavirus.
Absolutely. There is obviously, less than, a week ago today, we found out that Region 6 and 8 had some reopening steps in place. And for a lot of our businesses, that was a pretty big hurdle to get to in just a few short days. And so we solicited some questions from our business community, and there's a lot of them because really there is no roadmap to this. We've heard this many times, and the best way to get back to business and keep our economy going while keeping everyone safe and healthy isn't always a clear path. So one of the questions we had was, do you recommend patrons being screened before they enter a business?
I think that it's really important for everybody to know the rules and how to stay safe before they go into a business. These should be posted outside the business. Please don't enter if you're sick, wear a mask, sanitize hands in on the way out, keep your social distance. The rules should be posted, but I think there's a risk when you leave the house, and I don't think screening patrons, doing temperature checks, that kind of thing on the way into a business is going to be that productive. I think if everybody wears a mask on the way in, and wears a mask anytime social distancing can't be maintained, that's the best way to prevent spread. I do think employees should be screened on the way in. When you come to work, as we do here at the hospital, we're screening every employee as they come through, and they're asked to keep temperature logs twice a day. And if you have any signs or symptoms, then you would go get tested and you'd be off work for the next 10 days until you get better. So it makes sense to screen employees, but for the general customers, I think that that's probably not going to be a productive use of time.
Yeah, definitely. I think that too, as businesses look to reopen and think about what's appropriate and what's not, placing that screening on your employees is first and foremost. It should be part of your COVID, preparedness plan that businesses have and need to have according to the executive order as well. That signage is a big key, and out and about this weekend, everywhere that I was kind of checking and walking by had signs, and that's a good thing. And I think that comes back to, if you're not screening, hopefully, you're asking patrons to please put their mask on if they don't have one when they come in, or if it's down. I saw a lot of down this weekend, and it's like, just put it up, just walk in, you're good.
I think the signs are so important. People need to know the rules and expectations when they go in, and they need to follow the rules to stay safe. So the signs are going to be important.
Yeah,
I got a
distributed the one that all of us have, that I know that McLaren was a part of it with us, and several other organizations, to put that together to make sure that everybody had similar signage throughout the community, so that the message was clear every time you went into a business or establishment. And I think that's a good first step for sure. But you can't have too many that say, what the expectations are for a patron. So
I think a really important point with these masks too is that they're very effective in preventing spread of COVID. If you have COVID, a lot of people have very mild symptoms, and they can asymptomatically be shedding COVID. These are the very people that are out there transmitting it. If they put a mask on, you can decrease transmission of COVID to others by upwards of 75 to 85%. Very effective in stopping the spread if you're asymptomatically shedding it, or if you have a very mild illness. So everybody needs to be wearing a mask. And if we were all to wear masks, we could stop this in its tracks. So I would not, that's not negotiable at this point. People need to wear the masks when they're out and about.
Yeah, agreed. And for businesses, I know a lot of them are standing the hard line, and I applaud that, because it is a very difficult line to stand. You can't come into my business if you don't have a mask on.
Correct.
And that's tough. but stopping the spread is the key to this, so that we can get back to a society where we are actually out and in business. So the big question is do you think reopening slowly will have an impact for us? Or do you think we're going to see an increase in cases, I'm sure, but do you think doing it slowly, that stepped opening, will have an impact?
I think that stepped opening is important so we can see, how it goes, and we can see if there's an increase in cases. We're expecting this and we're prepared for it, but so we don't get this second wave and this huge surge increasing slowly and then see how things go and then moving on to the next step really makes sense, so we can do it in a controlled fashion rather than a free-for-all and then a huge surge and a second wave. It makes sense to go in steps, and it gives people time to prepare and make readjustments. So I think it does make sense.
I think it gives businesses too time to adapt as they move forward rather than one big rush too. I think it's, and knowing that the hospital is prepared and understanding that, yes, we will see an increase in cases, but not the overwhelming increase we would see if we just opened the floodgates. So a lot of businesses have questions in regards to if an employee tests positive for COVID, should they share that publicly? Should they remain open? Obviously, you have to clean, sanitize, shut down. We've heard all about different businesses that were open. I know that Ford had cases. They shut down for a couple days, cleaned, did what they had to do, and that was made public. Now, for small town, how do you handle that?
Well, this is why when employees are coming in, they should be screened on the way in. Are you healthy today? Do you have any signs and symptoms, cough, short of breath, fever, etc.? And if they screen positive for any of those questions coming in, they should go get tested and checked and stay off of work. And if we follow these rules, we know that we're doing our best to keep everybody in the establishment and patrons safe. If somebody tests positive, that information goes to the Department of Public Health, who's responsible for doing contact tracing. So I don't think it's needs to be on the establishment to share this information. It's the Department of Public Health does contact tracing. If somebody tests positive, to have them stay home until they're well. Typically, the CDC recommends being at home for 10 days. 3 days of those must be fever-free, and then come back when they're well.
Yes.
And then, the ongoing disinfecting of high-touch areas, wearing the mask. This is why the employee is wearing the mask, why everybody's wearing the mask. So if you are ill and you don't realize it, you're not spreading it to others.
And that's the key, is when we come back to that over and over, I keep hearing with the masks, people saying, well, I'm not afraid. Well, it doesn't matter if you're afraid. It's you protecting others.
You wear the mask because you're a good citizen, and you wear the mask because you're protecting other people in case you have it and don't realize it, to prevent spreading it to others.
And that's good to know for businesses as well, where that lies, and working obviously closely with the health department. We know that contact tracing is what allows that information to be released, because a lot of times it's dependent on how much contact there was with a business or somebody that was an employee. If they're a back stockroom person, you don't want to panic everybody as well. So there's a lot that goes into that. So I think it's important that businesses really, really utilize, like you said, that status tool, that making sure their employees are recording their temperatures and getting those questions in as soon as possible. This is one I heard a lot this weekend. I actually fielded some calls on as well. And that is, so the order states that when an individual is in a restaurant eating or drinking, obviously they're not wearing a mask. You can't wear a mask if you're eating or drinking. So is 6 feet enough distance between groups in restaurants, whether it's indoor seating or outdoor seating, if that group is not wearing a mask and the next group 6 feet over is not wearing a mask? There's a lot of question to that that I've heard, and what are the best safe practices and tips for that? It's asked that in the executive order that when you walk into a restaurant, you keep your mask on until you sit down, then you can take it off. So I think maybe some clarity and reassurance on that would be good too.
That's a tough one, because is 6 feet safe? That's kind of the distance when you cough or sneeze that the droplets can travel until they settle. So in theory, it should be safe. But as we know, people are walking past you, there's different airflow currents, so anything can happen. I think it makes sense for people when they're coming into the restaurant to wear the mask and take it off when they're eating or drinking, and staying 6 feet apart so when they cough, when they sneeze, those droplets can settle. That would be the minimum distance to have a safe environment. But that's just it's theoretical. Anything can happen. When you have like things to keep in mind, there's airflow in the restaurant, so you might want to have people coming in on one side, exiting on the other side, keeping in mind where the currents and the airflow are going in your establishment. There was an interesting epidemiological study that showed patrons in a restaurant, and there was somebody sitting here with COVID, and everybody on the other side of the restaurant got infected because that's the way the fans were blowing. So keeping in mind the airflow and the currents in the restaurant, staying outside, and if you can do outdoor seating would be more preferable. Just keeping it more open is better rather than a closed environment. When it gets louder and people are talking louder, you're getting more droplets spewing out. So it's difficult to really figure out how far is actually safe when there are so many variables.
And I know a lot of, with the way that the executive order was written for the opening for Region 6 and 8, that for restaurants, 50% capacity for a lot of them is way more than 6 feet as well. You've got a lot more. I know a lot that I've spoken to that didn't open their bar because they didn't feel that seating was safe enough. So I think that, paying attention as a business owner to what is going to make people feel the most comfortable, but what is also, if you can get more than 6 feet in between tables, by all means do it, I think would be good advice for businesses as well. And that outdoor seating, those that have that availability, much safer, I'm assuming, to be outdoor seating and 6 feet apart with no mask.
Correct. Yeah, that's a tough one, especially for smaller restaurants, how you can really even get that capacity and keep people 6 feet apart. Some people in some establishments, it may not even be feasible.
Right.
The to-go delivery stuff, really leveraging that is the way to go, I think, to, get creative and, pack picnics to go, pack meals to go. It's going to be much safer if we do that.
Yeah, and going forward, I think that we've adapted a lot, in a couple months as a to-go and curbside society, that we're like, okay, we can do this and still give our restaurants some business. I've also heard from a couple other restaurants that are doing time limits. So because they can only maybe have, 20 people in their establishment at a time to keep that safe distance so that they're keeping their patrons safe, that they're doing time limits. So rather than, you can have a 2-hour meal, actually, no, you can only have a 90-minute meal because we want to give have time to clean in between the next and really lock that down safely. So I think, like you said, getting creative for businesses is going to be the key going forward. To make sure that, we're all doing what we can to stop this, but allow ourselves to have some business as well.
Right. I mean, everybody wants to be, quote unquote, back to normal, but this is the new normal in the era of COVID, and we need to get creative and come up with solutions, understanding the virus, understanding how it spread, and come up with solutions and workarounds to keep everybody safe. And I've been blown away by the creative solutions everybody have come up with, really, and we need to keep it common. We can stay safe if we know what the risks are. And the important thing is to realize that we're really all in this together. Everybody wants the businesses to succeed and do well. We just have to figure out a new way of doing business.
Yeah, absolutely. Because, we understand, I think everybody understands, and health officials and business owners, everybody is on the same page. We want everyone safe, and we want business to continue in a sustainable form for our community. It's just being smart and taking those precautions to start off to make sure that we are being safe and we are following the information. Did you have anything else you wanted to add?
Well, I would point out that there are good resources out there. The CDC has all kinds of resources for entrepreneurs, restaurant owners, bar owners. So go to the CDC website. There's good information. The Michigan Department of Public Health has good information. And I also went to the Chamber of Commerce here in Petoskey's website, and there's good information there too. There's a whole game plan, and a policy statement about how to open up your business.
Yeah, we've worked really hard to make sure we get that information out there, and it does change quick. And that's the biggest thing I think as a business owner is knowing that make sure you're up to date, make sure you're watching, you can watch our chamber emails, you can do other things as well, CDC's website, michigan.gov too, because some things do change quickly. And protocols, I think, as businesses are going forward in our region in the next couple of weeks may change as well. We may see that, there's going to be some adjustments per the executive order as far as how businesses need to respond, trace, track, and do what they have to stay open. So
I would emphasize that this is all new. This is a novel coronavirus, and we're learning so much as we go here at the hospital from a medical standpoint. And it just extends to business owners as well. As we open up, we're going to learn new information, and we have to adapt, and we have to be able to change with the new information. People get frustrated when they thought they knew the rules and it all changes on them, but we're learning as we go. Everybody needs to be patient. Everybody needs to work together on this. But we can do it if we work together. Honestly, if we follow some simple rules, we can stop this virus. It's not that hard. If as a community, if everybody, 100% of people wore masks when they go out of the house, when they sanitize their hands, going into the business, going out of the business, wash their hands, sanitize their hands. And if we maintain that social distance, 6 feet apart, try and stay in opener areas, we can stop this. We can do it. But it's going to require everybody's work, and we're going to really need to get creative.
That's really good to hear. I mean, that is because patients together, we do this, we can stop it. We have to adapt during it, but we can do this. I think that's, the messaging that people need to know going forward is this is going to take a while, but it can be done if we all practice correctly.
We can, and we have done it. We have, at the height of this, our numbers in our respiratory containment unit in the hospital were in the 20 to 30 range, and now we have 1 or 2 patients in the respiratory containment unit. We really have crushed the curve here. We've done it. Now we have to bring it to the next phase and be smart about it, and we can totally do it. I can't tell you, though, the amount of hours that went into our policies, our procedures. Every day it seems like something changed. I think where business owners are right now is where we were 2 or 3 months ago with the anxiety of how do we do this? How are we going to stay safe? But we can do it, and we did it, and we decreased the numbers. But now we have to roll it out and extend it to, the rest of the community.
Yeah, absolutely. And there's not enough. I mean, I know it's being said all the time, but there's not enough thanks that as a community that we can give to the hospital and the staff and everyone who has put forth everything they have to crush that curve so that we can move forward. Because if without your efforts, we wouldn't be where we are for businesses now, getting this opportunity to get back to business. So thank you. It's not enough, but thank you.
Oh, this is what we do. We're here for you, and this is what we do. We're here to care for all patients, COVID non-patients. We're prepared and able to do it. And as an infectious disease physician, we always knew that this was possible, but this is what really I've trained my entire life to do. And it's just very satisfying to be able to share the knowledge and to see the results and to improve the lives and the health of everybody in the community.
Well, we're very grateful for it, and we're grateful to have you here. And any updates we need to do in the future, by all means, reach out to us. We would love to keep everybody as up to date as possible. I think it's good to have solid information from a respectable source, and it helps businesses tremendously to know that you've been there, you've done it, and they can too.
Correct. And we're here for questions. We're learning as we go along. We've reached out to other infectious disease groups and friends and communities, and we're all sharing information to help, move forward. And we need to share information. Any questions you have, contact us, contact myself, we'll share as we go along and get through this.
Thank you so much, Dr. DenBesten. I really appreciate you taking the time today.
Sure.